Okay, so far we've spoken about some of the characteristics of mild intellectual disability, and we've spoken about the prevalence and the causes of mild intellectual disability. And now I'd like to tell you about how intellectual disabilities are diagnosed. All right, how do you get a formal diagnosis? As I mentioned before, there's often telltale signs such as um, lower than average speech abilities. The child may look a bit different in the face. They might have less fine motor skills than a child of the same age. Okay, so let's talk about how they make experts make a formal diagnosis of mild intellectual disability. Okay, they look at two things, and these are the ability of the person's brain to learn, think, solve problems, and make sense of the world. And this is oftentimes called IQ or intellectual functioning. And they also look whether or not the person has the skills he or she needs to live independently. These are called adaptive behavior or adaptive functioning. Intellectual functioning, or IQ, is usually measured by a test called an IQ test. The average score is 100. People scoring below 70 to 75 are thought to have mild intellectual disability. When you start going below 70, 40 to 60, 20 to 40, that's when we're talking about more severe intellectual disabilities. Okay? Um, so, to measure adaptive behavior, professionals look at what a child can do in comparison to other children of his or her age. Certain skills are important to adaptive behavior. These are daily living skills, such as getting dressed, going to the bathroom, uh, feeding oneself. Also, communication skills, such as understanding what is being said and being able to answer appropriately. Also, social skills with peers. Okay, are you able to get along with family members, adults, and other people, or are those situations overwhelming? Um, so, as I mentioned, to diagnose intellectual disabilities, professionals look at the person's mental abilities and his or her adaptive skills.